Hi, hello everyone. Today I wanted to tell you regarding poisoning and the basic principles which are involved in the treatment of poisoning. So, poisoning, what is poisoning? Simply, poisoning is nothing but it is contact with a substance which results in toxicity of your body. The contact with a substance may result in toxicity in your body. So such type of thing is called as poisoning. And there are different types of poisoning substances, like first one, agricultural chemicals. There are many chemicals are there which we use in agriculture, which may act as toxic to your body, like pesticides, insecticides, herbicides, fungicides, and fumigants, etc. And also the drug and healthcare products. The drugs you will take daily and healthcare products, whatever you take daily, they may also act as poisons to your body, like painkillers. If you take the dose of the painkiller more, like aspirin or acetaminophen, it may act as poison to your body. And biological origin poisonous substances are microbial toxins. Microbial toxins, in the name itself, it is there. You see, microbial toxins means what? The poisons which are produced by microbes like bacteria, algae, fungi, etc. And phyto means plants. So the poisons which are produced by plants will come under phytotoxins. Zootoxins, zoo means what? Animals. So zootoxins means what? The poisons which may be produced by animals. So these are the different types of poisons which are available in nature. So if you come in contact with any such type of poisonous substance, then it will become toxic to your body. So that is called as poisoning case. So, and symptoms and signs of poisoning, you see, symptoms, what are the symptoms and signs of poisoning? Mainly, the symptoms will appear very soon after your contact with a toxic substance. It will appear very soon. But in some cases, the symptoms are delayed. It may appear late. Why? Because the substance which you have taken, its metabolite is toxic when compared with the parent substance. The metabolite product of that substance is toxic when compared with the parent substance. So that is why in such type of cases, it takes some time for symptoms to appear in your body. Ingested and absorbed toxins, if you ingest or if you absorb any toxic substance, generally it causes systemic problems in your body. If you take any corrosive liquids, then it damages the mucous membrane. If you take any toxins which affects the skin, then it causes some cutaneous symptoms like rashes or bubbles on your skin. Inhaled toxins means the substances which you inhale through your nose. It may cause the problems like upper and lower airway tract injuries. So these are the main symptoms and signs of poisoning cases. The next important thing is what are the general principles which we will apply for treating any poisoning case. If any poisoning case comes to any hospital, what are the general principles they will follow? So this is the thing which is important here. The first point is stabilization. Stabilization means you have to make the patient stable. How? By conducting survey for assessment and correction of life-threatening problems. You should know whether any life-threatening problem is there or not. What is the type of the poisonous substance he has taken? It may cause some life-threatening problem or not. Like that, you have to conclude, you have to do some survey, initial survey, for knowing whether the poisonous substance is life-threatening or not. If it is life-threatening, immediately you have to go for intensive care unit and you have to solve the case. If it is not life-threatening, then the second thing is evaluation. The second principle is evaluation. If it is not life-threatening or if there is no immediate problem is there, then what is the solution which we have to do is we have to detect and treat the following abnormalities. If any following abnormalities are there in such type of cases, then we have to treat those abnormalities. What are those abnormalities? Like hypothermia. Hypothermia means losing heat from the body. Hyperthermia means increased temperature of the body. Convulsions. Convulsions means fits and electrolyte disturbances. If there is any electrolyte disturbances, you have to supply electrolytes to the body. So this is evaluation. And the third one is a decontamination. Decontamination. In the name itself, it is there. Decontamination means what? Removing the contaminant from the body. Here, removing the toxin, removing the poison from the body. For this, if the poison reaches the stomach, then you have to perform gut evacuation. Gut evacuation means removing the content from the stomach, removing the poisonous or toxic content from the stomach by administering some activated charcoal or any other thing. If the contaminant is there in the eye, if the toxins are there in the eyes are the sensitive portion. So what you have to do, you have to irrigate, you have to clean the eye with normal saline for at least 15 to 20 minutes. For at least 15 to 20 minutes, the eyes should be cleaned with normal saline. Then the decontamination will be done. And the next one is elimination. Elimination of poison from the body. Elimination means completely removing the poison from the body. So how it is done is, it is done by techniques like forced diuresis, hemodialysis, hemoperfusion, peritoneal dialysis, and plasma perfusion. These are the techniques which are performed for eliminating the poison from the body. And the last one is antidote administration. So in some cases, if you know what is the problem with the poison, what type of poison that the patient has taken, then there are some specific antidotes are there. Those antidotes can be given to specific cases of the patients. In majority of the cases, if you don't know what is the exact reason for the poisoning case, then you should admit that patient in intensive supportive therapy, so that the treatment should be given to the patient. So this is about antidote administration, and these are the 5 basic principles or 5 general principles which are used for treating any poisoning case, like stabilization, evaluation, decontamination, elimination, and antidote administration. So this is the class for today. Thank you. Subscribe to my channel for more and more pharmacy videos. Jai Hind.